Yes, please
Hello.
go ahead.
Yes, sir. Good afternoon, sir. So through this poster, I would like to basically emphasize on the role of ductal stenting in our TGA patients, especially those set of TGA patients who present to us late. As we do understand that the gold standard for a patient with TGA is going to be arterial switch operations, but obviously the patients who are going to present to us late, there are chances that the LV would have been regressed. And at this position, it may not be able to maintain the systemic cardiac output. So we have various options. As we can see, we can either go for a direct settings or go for a primary switch, which would be requiring an ECMO support, or we go for a two-stage switch, which is possible by either training the left ventricle by going for surgical options like a PA banding or BT shunt, or going for ductal recanalization, which we'll be focusing more on this in this paper. So recently we had like two of the cases. I'll be discussing the second case, which came to us. It was a 65-day-old child who presented to us with low saturations. When we did the echo, we found that this child had a regressed LV. And so we still decided to take this child for a two-stage switch. We took him to the lab. We initially did a arterial, we did a aortic angio where we were able to get a ductal diverticulum. And through this, we were able to figure out the site, which we presumed to be the site for PDA. And using a feeder XT wire, we were able to probe through it. We had to inflate it. We had to basically dilate it using a balloon, a 1.25 mm balloon. And following that, we were able to stent it. What we see down is an image where we can see how at presentation the LV was banana shaped and squished, and later on we see that the septum is almost in center where the LV is almost having near systemic pressures. We were able to take this child for surgery. The second pick has been taken about 10 days post the stenting procedure, and following this, the child was taken for the ASO, and the post-op case was uneventful. This is something which we haven't been doing very often. So since we found this is something which did give us good results, we thought it would be a nice idea to share it on this forum. Thank you.
Satish.